Well, thank you very much. I'll share my screen now. Um, hey, everybody. I'm Sean Cahill from the Fenway Institute, and I'm going to be talking about Project 2025's threat to LGBTQI plus older adults and older people living with HIV. I'm just going to start my stopwatch here. I'm the director of health policy research at the Fenway Institute in Boston, and I have a couple of academic appointments. And as I was saying to Liz just now, I serve on the Massachusetts Special Legislative Commission on LGBT Aging since 2013. And the Fenway Institute is part of a federally qualified health center in Boston called Fenway Health. We serve everybody, but about half of our 35,000 patients are LGBTQIA+, about 6,000 are transgender and non-binary, 35% BIPOC. We have 2,300 patients living with HIV and 3,500 patients on PrEP for HIV prevention. I need to get a data point on what percentage of our patients are older adults. But certainly a lot, including a lot of our HIV patients are definitely 50 plus, 60 plus. And we do research, education, training, and policy in support of sexual and gender minority health equity issues and sexual health. So what I'm going to do in the next few minutes is give some background on Project 2025, who's behind it, what the connection is with one of our major political parties and their candidates for election. Look at plans for the U.S. Department of Health and Human Services agencies, including CDC and Food and Drug Administration, and some other agencies, National Institutes of Health. Also talk a little bit about racial equity issues and gender equity issues in some of the proposals. But the main focus is going to be on LGBTQI plus equity and HIV policy and what this means for older people. And then I'll just end with a quick call to action to educate our communities about the very real threat that this agenda poses and to prepare to resist it, because there's a good chance, depending on what happens in the near future, that it could be implemented starting next year. So if you want to learn more details about Project 2025, we have an issue brief on our website titled Project 2025's Threat to LGBTQI plus Equality, Safety, and Health, Racial and Gender Equity, and Sexual and Reproductive Health. So this is a potential plan for a second Trump administration. I'm just going to shrink this a little bit. This is a potential plan for a second Trump administration from influential former staffers and right-wing activists, and it's all kind of produced by and packaged by the Heritage Foundation, which is a leading right-wing think tank in Washington, D.C. that's been around for decades. If former President Trump is elected, key elements of Project 2025 have a really good chance of being implemented. And I'm going to mention a few people who were in the first Trump administration and are very active in this report, in writing chapters of the report. So one is Russ Vought, who was director of the Office of Management and Budget under the Trump-Pence administration. He wrote part of this report. He's being considered for White House Chief of Staff, and he was policy director for the RNC's 2024 Platform Committee. He's a self-described Christian nationalist, and we can talk about what that means in the Q&A if you want to. So this is just a picture of him. Another person I would flag, and whom I'm going to quote a lot, is Roger Severino. You may remember him. He's a longtime religious right activist. He ran the Health and Human Services Office of Civil Rights under the Trump-Pence administration. He is described by the Atlantic magazine as an outspoken advocate against abortion and same-sex marriage, and by HRC as a radical anti-LGBTQ rights activist. So he litigated a number of the court cases against marriage equality. He served as a legal counsel in a bunch of those. And at the Heritage Foundation, where he is now and where he was before he served in the Trump-Pence administration, Severino has argued that sexual orientation and gender identity can be changed through prayer or through ex-gay therapy or reparative therapy, and that they should not be included in non-discrimination laws and federal regulations, and that such inclusion violates the religious freedom of of conservative people or right-wing people, which is not true. So this is a picture of Roger Severino. And the advisory board for Project 2025 is really a who's who of the religious right. So I've been keeping an eye on the religious right for almost 35 years now as a political scientist. And a lot of these groups have been around for a long time. They've maybe, changed their name a little bit, like the Alliance Defending Freedom used to be called the, I think, Alliance Defense Fund. But these groups have been around for a long time. Concerned Women for America, very active in the 1990s, Family Research Council. And then Jay Sekulow, who used to run ADF and now runs the American Center for Law and Justice, he has been active in promoting anti-LGBT policies in Europe and in other parts of the world, as well as here in the US, but also served as President Trump's first impeachment lawyer in his first impeachment trial. So the Alliance Defending Freedom is a leading opponent of LGBTQ equality, including marriage equality. And this is just a quote from their website. This is like their vision of the work that they do and one of their goals, which is that marriage and family are protected and ensuring that the law respects God's created order for marriage, the family, and human sexuality. And as you might imagine, that order doesn't include LGBTQ plus people or same-sex couples. President Trump claims that he knows nothing about Project 2025. I have no idea who's behind it. I have nothing to do with them. But this is not true. President Trump gave a speech to the Heritage Foundation 2.5 years ago, in which he indicated that he knew about Project 2025. He said the critical job of institutions such as Heritage is to lay the groundwork. And Heritage does such an incredible job at that. They're going to lay the groundwork and detailed plans for exactly what our movement will do when the American people give us a colossal mandate to save America. Already we know a very big part of our agenda. So this indicates that, he knew about this, and people from former people who he hired were very involved in the writing of this report, which was published in 2023 and late 23, but has really been getting a lot of attention. We've been working on it since early 24, and it really started to get a lot of attention maybe in late spring and early summer of this year. J.D. Vance is close to the, quote, Project 2025 architect, Kevin Roberts. Kevin Roberts is the CEO of the Heritage Foundation. This is a picture of him with Vance at an event. And Vance actually wrote the foreword for a book that was supposed to be published last month by Kevin Roberts, but it was delayed, I'm guessing due to pressure from Vance and Trump, because it was embarrassing for them, probably delayed until after the election. And another thing is that the Heritage Foundation was very influential under the Trump-Pence administration. And Forbes magazine says that 64%, or actually the Heritage Foundation told Forbes magazine that 64% of the policy suggestions that it made during the first 2 years of the Trump administration were adopted and implemented by the Trump administration. So that's a track record right there that's indicates that it's likely that some of these proposals will be implemented in a future Trump administration. Also, Trump implemented a number of similar policies in his first term. So this is a report. Hopefully, the control screen that I see at the bottom of my screen is not blocking your view. If it is, tell me and I'll try to get rid of it. But hopefully you can see this says 1 year in, Trump administration amasses, I don't know, striking anti-LGBT policies, something like that. This is a report we published in early 2018 about the first year of the Trump administration. And we ended up doing annual reports on Trump-Pence and what they were doing. They're on our website if you're interested. But the point is that Trump already implemented a lot of anti-LGBT policies, including banning military service by transgender people, repealing SOGI non-discrimination regulations governing healthcare, insurance, and the PACE program of elder services for frail elders, promoted religious refusal policies in more than $500 billion a year in HHS-funded services, and relentless attacks on the Affordable Care Act, which helped millions of people living with HIV get insurance who previously couldn't because of the ban ban on coverage, or the policy of insurance companies to refuse to cover people with pre-existing health conditions. LGBTQ people, people of color, particularly Native Americans and Hispanics, have the highest rates of uninsurance, and that was brought down significantly. We still see racial disparities in insurance coverage, but everybody has the situation improved for every racial ethnic group, even as there's still disparities where Asians and whites have the lowest rates of uninsurance, Black people are in the middle, and then Hispanic and Native American people are kind of the most uninsured. We also have seen a lot of anti-transgender activism in this political cycle, in this election cycle. So last year at the Conservative Political Action Committee conference, the Anti-Defamation League reported that anti-transgender hate took center stage. I think you're all pretty familiar with the rise of anti-transgender legislation in this country, particularly in the current election cycle, and kind of, since the last Congress was elected in 2022, a dramatic increase in the number of anti-trans bills, but really going back to 2015, and really, right when we had victory on marriage equality with the Obergefell Supreme Court ruling, the religious right pivoted and said, okay, we're going to go after transgender people now. And we're kind of in the third wave of anti-LGBT activism, which if I have time, I'll get into a little bit. Also, President Trump has made anti-transgender claims and politics not central, but certainly an element of his campaign. So in his debate with Vice President Harris, the only mention really of LGBTQ issues was Trump's false claim that Vice President Harris wants to fund or cover transgender operations on illegal aliens. In other words, gender-affirming surgery or gender-affirming care for undocumented immigrants. Not true, but all right. So now I'm just going to stop for a minute and let you read this text. So this is from the foreword by Kevin Roberts, the CEO of the Heritage Foundation. And just take a second and read this, and then I'll discuss it. So this is really irresponsible, incendiary, and harsh language, dehumanizing language describing transgender people, people who support transgender youth or LGBTQ youth. It's really not clear exactly what Roberts is proposing or what he's referring to. Whatever he is proposing is likely not legal. The idea of, arresting and imprisoning librarians and educators who are supporting LGBTQ youth, or putting LGBT-themed books on the shelves of libraries. It's probably not legal, but it's still very dangerous that he's proposing it. Is he referring to gender-affirming care for youth? Is he referring to drag queen story hours in public libraries, LGBTQ-themed books? Is he referring to safe schools initiatives to support LGBTQ plus youth who are being, victimized and bullied, and who have 4 times the rate of suicidal ideation and suicide attempt, partly as a result of that violence victimization? Probably. And I noted that according to the Centers for Disease Control Youth Risk Behavior Survey, the latest survey that there's data on their website for, which is 2021, 26% of young people identify as LGBTQ or are unsure of their sexual orientation or gender identity. I think it's like 21% are LGBTQ, and then 5% are unsure or questioning. But like I said, even if it's of questionable legality and constitutionality, this is still a very dangerous thing to be saying. And this language is just so over the top, and problematic. We see in this report often phrases like transgender ideology, transgenderism. So Roberts says, children suffer the toxic normalization of transgenderism, with drag queens and pornography invading their school libraries. Now, most school libraries have a filter that blocks pornography, but I think he's basically saying that, books that are about LGBTQ people are by definition pornographic. These terms, transgender ideology and transgenderism, demonize transgender people. suggests that trans, non-binary, and gender diverse identities are simply a new fad, neglecting and delegitimizing the ongoing social justice movement for transgender equality and medical research that documents that gender dysphoria and gender identity are real. Okay, so now getting into some specific plans in this Project 2025. Roger Severino's starts off with a lie and basically says that HHS needs to restore and enhance conscience protection regulations that allow medical practitioners to participate in federal healthcare programs without being compelled to provide sex changes or similar services. Well, in reality, no one is being compelled to provide gender-affirming surgeries. That's just a lie. And they are expected to provide basic healthcare services to transgender patients. So if a transgender person shows up in an emergency room with a wound, that person has the right to get healthcare, or whatever health issue is affecting that transgender patient. But nobody is forcing anyone to provide gender-affirming surgery to patients. Severino is very critical of how CDC handled COVID-19, and I'll quote in a second one of his statements about that. So he calls for the dismantling and weakening of CDC's policymaking and public health prevention role, and this would significantly weaken our response to future disease outbreaks. Severino also proposes splitting the CDC into two pieces, one of which will be focused on collecting and analyzing state epidemiologic data, and the other focused on making public health recommendations and policy recommendations. But he also says that we should significantly reduce the policy power of CDC, that they should have really minimal power to make public health policy. And like I said, he's critical of what CDC did regarding COVID. So here he talks about how he's critical of how CDC basically shut down churches, but other institutions, businesses, and schools and so on in the early months of the COVID pandemic. He says, how much risk mitigation is worth the price of shutting down churches on the holiest day of the Christian calendar, which I think he means Easter, and far beyond, as happened in 2020? What is the proper balance of lives saved versus souls saved? The CDC has no business making such inherently political and often unconstitutional assessments and should be required by law to stay in its lane. So, certainly as a religious leader, he has a right to talk about souls saved, but as a public health official, as somebody who ran Office of Civil Rights under HHS and who could be the next HHS secretary if it's not Robert Kennedy Jr., it's really striking to me that he says, what is the proper balance of lives saved versus souls saved? In other words, implying that it's more important to save souls, even at the cost of people dying from getting infected with this infectious disease and dying. Severino also calls for CDC to stop collecting gender identity and disease surveillance, and also says that CDC should basically fund research into contraception using the rhythm method. So really going back to the 1950s, before Griswold versus Connecticut, when married couples couldn't even get contraception without a doctor's prescription. So for the FDA, Severino calls on the FDA to rescind approval of mifepristone and misoprostol for medical termination of pregnancy. And some of the proposals related to NIH are really concerning. Severino denounces quote-unquote woke policies that allegedly hold sway at NIH. He calls for the abolition of the Diversity, Equity, and Inclusion, or DEI office. He says that NIH, he also says this about CDC, that they've been at the forefront in pushing, quote, junk gender science, unquote, and instead calls for NIH to fund research on the alleged harms caused by gender affirmation. But I think the most disturbing proposal is, in terms of the impact on health research, would be to block grant NIH funding to states instead of funding this federal agency with several billion a year in funding to do research on cancer and heart disease and all these other health issues affecting the American people. There are many reasons why this is problematic. One is states are not equipped to lead the same quality of health research that NIH currently conducts. But also many states would likely refuse to fund LGBTQI health research, racial equity research looking at racial disparities, because there's been such a attack on DEI that anything that involves, looking at people of color in particular is now suspect to some people. And I think if those folks are in charge in many states, they would discontinue that kind of research funding. And the other thing is, we have a sexual and gender minority research office now at NIH, which is really exciting, which was created in 2016 by the 21st Century Cures Act. And we have been seeing a lot more research happening in the last 8 years to look at sexual and gender minority health disparities on top of HIV. But maybe 2/3 or 3/4 of the LGBT-related health research until recently was HIV prevention research. And that's important, but cancer is a huge issue, particularly for women in the LGBT community. Transgender and gender diverse people have unique concerns related to cancer screenings and prevention. And behavioral health. There's so many other issues that are important, cardiovascular health. Kidney disease. We just recently published a paper showing higher rates of kidney disease among older LGBT and other sexual orientation individuals compared to straight individuals. So, and that research is really just getting off the ground. Research looking at the intersection of people of color and LGBTQ plus. It would be very problematic if this proposal were implemented. There's also just, calls for ending gender identity data collection. Elsewhere, there's calls for ending, for removing any mention of sexual orientation or gender identity from federal regulation. I think it's on the next slide. And the CDC warns that without this information, LGBT patients and their specific healthcare needs can't be identified, and the health disparities they experience can't be addressed. Important healthcare services may not be delivered to these populations. There's also broader opposition to LGBTQI plus equality, including a call for HHS to repeal SOGI non-discrimination rule, implementing the Affordable Care Act's non-discrimination provision. This was finalized this spring, and it has robust protections for LGBTQI plus people. It mentions intersex people, it mentions non-binary people. It's incredibly important, particularly because it provides federal protection for people in states, the almost 30 states that don't have state gender identity non-discrimination and sexual orientation non-discrimination at the state level. So that's really important. Severino also calls for the total removal of any mention of SOGI, DEI, reproductive health, and abortion from all federal laws, regulations, contracts, and grants. This would have a huge impact on that research that I just mentioned was just getting off the ground, but also on all the data collection efforts which have proliferated under the Biden-Harris administration to collect more data on LGBTQ plus people to understand not only how we're experiencing, what our health disparities are, but how we're accessing government services across the board. So what would this mean for pro-LGBTQI innovations at the Administration for Community Living? We've seen a lot of advances at ACL, thanks to the wonderful advocacy of SAGE and many of you on this call. If there can be no mention of SOGI in federal government regulation, a lot of these advances regarding older LGBTQI people and older people living with HIV will be rescinded. So this could include, for example, ACL guidance to explicitly include LGBTQI plus older adults and older people with HIV in state aging plans, and also inclusion in the definition of greatest social need. Also guidance to collect SOGI data in elder services, guidance for states to do that so that we know the extent to which members of our communities are accessing elder services. And this would include data collection related to dementia and Alzheimer's as well. We also see other attacks on equality in the area of parenting. There's proposals, calls for the privileging of heterosexual married couple families over other families in the provision of human services. This is something that the religious right proposed in the 90s when Bill Clinton was president, and they implemented some of these policies under George W. Bush. But we published a whole analysis of this at the LGBTQ task force in 2001, myself and Kenneth Jones. They would also allow adoption agencies to discriminate against families that don't have a mother and father. Severino repeatedly calls on HHS to declare gender-affirming care harmful, to end support for gender-affirming care. He specifically calls on the Ryan White program, the HIV/AIDS program, to rescind 2021 guidance that allows use of Ryan White funds for gender-affirming care. And he calls on the Centers for Medicare and Medicaid Services, or CMS, to issue a strong policy opposing gender-affirming care for Medicare and Medicaid beneficiaries, portraying gender-affirming care as dangerous to people's health. So just a little bit more about Medicare and Medicaid. This is the Center for American Progress. They talk about how Project 2025 would make Medicare Advantage the default option for all Medicare enrollees. This would be a multi-billion-dollar giveaway to corporations that would limit older Americans' healthcare choices while putting Medicare's future at risk. So what exactly does this involve? The proposal involves making Medicare Advantage the default enrollment plan for enrollees. And why this is important is that original Medicare has much more flexibility than Medicare Advantage. Original Medicare can be used with any of the 90% of U.S. providers who accept Medicare, healthcare providers. Medicare Advantage only covers care by providers in a network. So these networks may have LGBTQ plus competent and affirming providers. They may have providers who can provide gender affirming care to transgender and gender diverse patients. They may have providers who can provide non-judgmental affirming HIV prevention and treatment or other sexual health care, but they may not. Culturally affirming behavioral health care for LGBTQ plus people. We just don't know. So Medicare Advantage really restricts the number of providers you can access and could have particular impacts for sexual and gender minority people. And Medicare Advantage also has prior authorization requirements, which original Medicare doesn't have, that could make it harder to access certain kinds of medications and treatments. This is from the AFSCME website, the Federation of State and County and Municipal Employees. It talks about how this Project 2025 would increase Medicare Part D prescription drug prices, among other things. So I looked into that a bit, and basically the Project 2025 and the candidate himself, Donald Trump, are calling for repealing the Affordable Care Act. This is something that Trump nearly did, but for the thumbs down in the middle of the night by Senator John McCain, we almost lost the Affordable Care Act if it weren't for Senator McCain. And he definitely wants to try again to repeal the Affordable Care Act. This would remove more than 21 million people from insurance coverage and force thousands of people with HIV off of insurance coverage due to the pre-existing condition provision, which was a key element of the Affordable Care Act. It banned prohibiting, and it banned non-insuring people based on pre-existing condition. But Project 2025 also calls for repealing the part of the IRA, the Inflation Reduction Act, that authorizes CMS to negotiate prescription drug prices for Medicare patients. So we haven't seen that really kick in yet. It's not going to be till 2026 that people start seeing the savings, but that is a huge policy development, which Project 2025 wants to rescind. A little bit on DEI. This is from the chapter on the Agency for International Development, which is basically U.S. foreign policy. And this former appointee, Max Primorak, claims that DEI has racialized the Agency for International Development and created a hostile work environment, presumably for white people who work there. And then says the next conservative administration should dismantle USAID's DEI apparatus by eliminating the chief diversity officer as a position. He might mean also that, it's a hostile environment for men because of efforts to diversify based on gender. Remove DEI requirements from contract and grant tenders and awards. Issue a directive to cease promotion of the DEI agenda, including the, quote, bullying LGBTQ agenda, and eliminate funding for partners that promote discriminatory DEI practices. So not only do they want to stop DEI within AID and with all groups that get funding from AID to do programmatic work, but they actually want to require any grantees to end DEI within their organization. So a private nonprofit or human services agency that's doing some kind of work funded by USAID overseas would basically be forced to stop any DEI efforts. We also see a call for, in a chapter called The Common Defense, which doesn't seem to have an author for some reason. But in this chapter, Project 2025 calls for an end to the promotion of abortion rights and LGBT rights in U.S. foreign policy. One of the key innovations of the Obama-Biden administration and the Biden-Harris administration has been making LGBTQ equality a key goal of U.S. foreign policy. And certainly the Trump administration de-emphasized that as a key goal. But they're also critical of U.S. embassies and consulates flying the rainbow flag and the Black Lives Matter flag. This chapter also, the Project 2025, according to a LGBT advocacy group that's focused on U.S. foreign policy, the Council on Global Equality, says that Project 2025 wants to end support for the U.S. refugee admission program, which has allowed many LGBT refugees to come here and seek asylum and seek refuge from persecution in their home countries based on being LGBTQ+. Okay, so I guess I have time. I'm going to just do this real quick. I wanted to just kind of put all this into historical context since the 70s. So I just have about half a dozen slides. So as hopefully you're not going to be traumatized by this. There's a couple of problematic things in the next few slides. But this is Anita Bryant, who is a leader in the 1970s of the anti-gay movement. She led a group called Save Our Children, and was very active in helping repeal a sexual orientation non-discrimination law, what we used to call a gay rights law in Miami-Dade County, Florida in 1977. So this wasn't the first attempt to repeal a gay rights law. The first one was in 1974 in Boulder, Colorado, but this was the first one that got national attention, as you can see being on the cover of Newsweek. So we've really seen three waves of anti-gay and then later anti-LGBT activism. Maybe earlier it would be like anti-LGBT activism is more accurate. But we've seen three waves since 1974, so over the last 50 years. The first wave involved ballot campaigns against sexual orientation non-discrimination laws, either repealing existing laws or, in the case of Colorado, passing a statewide law through a ballot referendum that prohibited municipalities and the state legislature from passing such a law. These continued up until the early 2000s, but there were a lot of efforts made by LGBT activists and allies to defend these laws, and I was involved in one in Miami-Dade County in 2002, and in Cincinnati, I think in 2002, maybe 2001, and we won both of those ballot campaigns. And I think because the religious right was started to lose on this issue, and most Americans by that point supported non-discrimination for sexual orientation. So what did the religious right do? It pivoted and said, okay, we're going to go after marriage now. So they focused on anti-marriage laws. The anti-marriage laws started out in the mid-90s in the States, but the religious right started organizing ballot campaigns in 2004. And there were 13 ballot campaigns that year. And that helped George Bush get elected president in 2004. Certainly did. And so those ballot campaigns continued until 2012, at which point in 2012, there were 4 of them, and religious right activists lost all 4. Because what happened in that 8-year period, the American public went from being overwhelmingly opposed to marriage equality to being overwhelmingly supportive of marriage equality. And so, again, the religious right They lost and they pivoted and they said, okay, what are we going to do now? Let's go after transgender people. There's not as much understanding of transgender people. There's not as much support. So that's what they did. So we started seeing statewide preemptive restrictive laws that said you can't have gender identity non-discrimination, or repeal of municipal non-discrimination laws like in Houston, Texas, Harris County, Texas, and in North Carolina were two of the more prominent ones. These were particularly going after public accommodation laws, and they were anti-transgender laws. So really this current wave we're in started about almost a decade ago, and it's primarily focused on transgender equality. But a lot of folks might forget that 20 years ago, about 40 states prohibited the recognition of same-sex marriage, but also in most of those states, recognition of domestic partnership and civil unions. So really limited recognition. People said, you can't be married, but you can't even be domestic partnered. And many of those states, I think about 25, had constitutional amendments, which would have been really difficult to overturn were it not for the Supreme Court ruling in 2015, Obergefell, which struck down all these laws and amendments. And so this is a map from the present, just looking at laws that prohibit access to gender-affirming care for adolescents who are transgender and gender diverse. And there's 26 states now that restrict access to gender-affirming care for young people. There's many other anti-trans laws, anti-LGBT laws, like no promo homo laws that prevent the discussion of LGBT issues in schools, and so on. But this just looks at medical care. And some of these laws prohibit care for adults. Some of them are 26 and under, and like in a state like Florida, where it's legal to get gender-affirming care if you're an adult, but if you're on Medicaid, Medicaid will not cover it. And that's an increasing strategy that's being used. I'm going to skip, well, I guess there's a couple of slides where I just say these are some of the major claims that religious right groups made. So in the 90s, Beverly LaHaye from Concerned Women for America said, your church could be forced to hire or marry homosexuals. Churches that refuse to marry gay couples could be closed. They said this again right before the Supreme Court deliberations, and this is not true. You know, the Catholic Church still doesn't recognize same-sex couples. Nobody's closed the Catholic Church in the United States. Same with the Southern Baptist Convention. So it's just not true. And here's Lou Sheldon 20 years ago telling Congress not to pass the Employment Non-Discrimination Act, which I think back then just included sexual orientation. It didn't include gender identity. And soon thereafter it did. But he says if you pass this law, you're going to elevate homosexuality, which will give homosexuals more rights than other citizens and cause us, i.e. religious conservatives, to lose our rights. That's not true. It wasn't true then. It's not true now. Civil rights is not a limited pie. It's not a zero-sum game. And then here's Ted Cruz saying gay marriage is the greatest threat to religious freedom in American history. Wow. Bigger than the threat of, going to war with Nazi Germany. That's really interesting. But so again, making this claim that marriage equality is going to lead to oppression of right-wing Christians, not true. So we see a lot of also common sense claims, quote unquote common sense. So in 1977, Anita Bryant said, if gays are granted rights, next we'll have to give rights to prostitutes and to people who sleep with St. Bernards and to nail biters. So diminishing, the gay and lesbian and bisexual community, diminishing what's at stake, which is the right to have a job, rent an apartment or buy a house, put food on the table. That's what's at stake. It's not as trivial as, nail biters. And, people who, anyway. And then in the 1990s, we heard the religious right say marriage is between a man and a woman. And today we hear the religious right say things like no men in women's bathrooms. And so these are allegedly common sense claims, but they're actually very dismissive of the people involved and the people whose equal rights are involved and what's at stake for people in the minority groups, the LGBTQ plus minority groups whose basic human rights and ability to function in society are at stake. So I'm going to end with a call to action. We need to really educate our communities about the very real threat posed by Project 2025. Trump is strategically, and Vance, they're strategically distancing themselves from this effort. I would not believe that. Trump frequently lies. Vance also lies frequently. This Haitian pet thing is just made up out of whole cloth. The Project 2025 authors are former and likely future Trump administration officials, and the policies that they're promoting are really just a more extreme version of what we saw from 2017 to 2021. These are priorities of the religious right. They have been since the election of Ronald Reagan. This is a core constituency of the GOP coalition, and the religious right has made anti-LGBT organizing and anti-abortion organizing two central strategies of its movement since the 1970s. So we really have to be honest about the threats that face queer people, people of color, women, and immigrants in particular, and really be prepared to resist, because I think that there will be much less restraint on a second Trump administration than there was on the first one, based on the immunity ruling from the Supreme Court.